you again. So,
okay, go ahead. And don't worry, I'm going to do it through this audio. Yeah. You can go ahead and start.
okay, that sounds good. All right, let's go ahead and get started. For everyone who's um, online, good morning, good afternoon, or good evening, depending on where you are in the world. My name is Mitchell Hightower, and on behalf of the APEC Life Sciences Innovation Forum, I'm very glad to welcome you to this third webinar in our ongoing series on the role of vaccination in maintaining health and economy during pandemics. So we're very excited for today's discussion of financing life course immunization for COVID-19 response and beyond. I'm very grateful to our moderator, Anupama Tantri of MSD, for helping to steer this conversation. So we're looking forward to your thoughtful questions and interaction as well. So if you're joining from our WebEx, you're welcome to provide questions in the chat function here, or if you're viewing the live stream, feel free to enter questions into the chat function to the right of the video that you're watching. And then one last note before we get started is that we'll be sharing a recording and event summary on the event website in the weeks following this session, and we'll share additional information on those future webinars as well. So look forward to that after this. So with no further ado, I'll just give the floor to our moderator, Anupama Tantri, Executive Director of Vaccines Public Policy at MSD.
Great, thanks so much, Mitchell, and good morning, good afternoon, and good evening to everyone. I'm delighted to be moderating today's session on financing for immunizations and to be joined by a very distinguished panel of experts. The issue of immunization financing is so timely and critical right now for several reasons. The role of vaccination in protecting health and the economy has never been more clear than it is in this moment. The world is looking to vaccination to help prevent serious illness, hospitalizations, and death from COVID-19, to protect our essential workers, to help economies open back up and grow, and to halt transmission and ultimately end this pandemic. Yet, as countries around the world struggle to roll out COVID-19 vaccines and recover routine vaccination rates, which have dropped dramatically around the world, the pandemic has also made it very clear that immunization programs have long been undervalued and underfunded. Before the pandemic, only 11% of public spending on health was for prevention in low and middle income countries, and only 3% among OECD countries. Across countries in Europe, median spending on immunizations over the second half of the last decade was only 0.3%, less than 1% of health budgets. And the global recession resulting from the pandemic is going to continue to stretch and strain immunization budgets. And the pandemic is already necessitating new approaches to delivering routine vaccination services, catch-up campaigns to recover vaccination rates, and of course, the infrastructure necessary to roll out mass vaccination efforts for COVID-19 vaccines. We see governments, development banks, donors, and others around the world mobilizing emergency or supplemental resources for COVID-19 vaccination. But whether and how this can translate into more long-term investment to strengthen the basic foundation and building blocks of immunization systems and have a more lasting impact remains to be seen. We know that continued underinvestment in immunizations can corrode the critical infrastructure and systems that are necessary to equitably deliver vaccination services, to expand access to new and underutilized vaccines across all stages of the life course, and to enable public health systems to address emerging infectious diseases of the future. And so against this backdrop, APEC efforts to promote sustainable immunization financing and encourage discussions and sharing, such as the one that we have today, are really critical. And our panelists are going to help us understand more about today's immunization financing landscape, both for COVID-19 vaccination, but also more broadly, and what more can be done to invest in and enable sustainable financing for immunizations. So we have with us today Dr. Chinwei Chi, who is a director for the Center for Global Health at Oregon State University. And among his many positions, he previously served as a policy advisor for the National Health Insurance Administration in Chinese Taipei. We also have Dr. Mursalina Islam, who is a program director and senior economist at ThinkWell, with extensive experience working with countries and the private sector on health financing. And we have Dr. Pingying Li, who is a professor at National Taiwan University and also serves as chair of the Advisory Committee on Immunization Practices at the Centers for Disease Control in Chinese Taipei. So really fantastic panel that I'm excited to be hearing from today. And we also want to hear from each of you, our audience. So please submit your questions for our panelists as we go through today's session. So with that, I'll start with the first question, which I will pose to Dr. Chi. Dr. Chi, what's needed to effectively deliver COVID-19 vaccination? And as such, what does that mean for what emergency vaccination funding must cover? How is this the same or different than the needs for other vaccination?
Thank you very much. Mitch, could you please share my slide? Okay, Mitch, can you advance the slide? So I have prepared some visual slides. So this is what I was supposed assigned to address for those questions. Next one, please. So this next slide shows as of April 30th, among the 21 economies of APEC, where we are in terms of vaccination. And there's an interesting pattern. Those economies that has a highest vaccination rate happen to be also those economies that over the last year has among the worst prevalence and deaths. Whereas those economies at the bottom have the lowest vaccination rate, generally, with a few exceptions, happen to be those economies that did very well in containing the pandemic. So there's a relationship among those economies that who are more aggressive in mobilizing vaccination versus those who are less. Next one, please. Next, yes. So in this next slide, to address the question, I show us three inequality. So the first one, the procurement does not equal delivery. And a classic example is Canada. Among all economies in the world, Canada was #1 in terms of procurement of doses of vaccine per capita. Yet, because of the barrier of delivery, Canada has to postpone its second dose for those who already received the first dose. That they postponed twice, from 1 month to 2 months, way beyond the recommendation. So that's a classic example. Just because you have done procurement doesn't mean you will get the delivery. And then the second inequality is just because the vaccine is available does not mean it is accessible. An example from the United States is in many states that while the availability are there, there are enough supply of vaccine for most counties, yet there has been a huge variation in terms of accessibility. For example, migrant workers and people work in the meat processing, they cannot access those vaccination sites, and they have to work, they're paid by the hour. So just because the vaccine are there doesn't mean that people have access. And then the last one is vaccination does not automatically translate to protection, because just because we completed the vaccination, we still face at least two uncertainty in terms of protection. One is we still don't know how long the vaccination, even people who completed 2 doses, how long the protection effect will last. And the second uncertainty is as we are encountering different variants, we still have limited information on how effective are the current vaccine against those new variants. Next slide, please. So in this next slide, I show the flow of the process of the vaccination in every economy. And then at the bottom row, I show the mobilization of resources and infrastructure required. The first step is procurement. And unfortunately, the economy that has higher income overall has claimed a much bigger share of the procurement. But as I mentioned earlier, the procurement does not equal delivery. So in the first stage of procurement, we need finance, we need international collaboration, and we also need a health system, a strong system to estimate the need for the economy, but also information system. And those resources are also required in the next stage of delivery. And that especially the finance and international collaboration play a big role in translating procurement into delivery. And then once the delivery is accomplished, that means the vaccine has been delivered to an economy. The next stage is distribution within an economy. And here again, finance plays an important role, but also the health system of the economy plays very strong role. And for example, we need the infrastructure, particularly public health infrastructure, as well as information infrastructures to prioritize who within the economy, which population, which group will be first, and then second and third, and so on and so forth. But also governance is important factors to help the economy to decide to develop the priority. And so once we started the distribution within the economy, that depending on the size of the economy, it distributed to the regional, local level, and that begins the vaccination. And this is a huge endeavor that requires finance, but also a strong health system. And particularly, information system plays a very important role in the next 2 stages, because we need the information system to know who within the economy, which population have been vaccinated. And this is especially challenging for those vaccines require 2 doses, because you need to track who already received the first dose and in what time frame they need to be reminded or to come back for the second doses. And infrastructure is also play a very important role. And the vaccination will be a long process. Besides, most vaccine require 2 doses. As I mentioned earlier, we still don't know how long, even completing 2 doses of vaccine, how long the protection will last. And it is fairly likely that most vaccine may require a booster. That means this infrastructure set up for vaccination will continue to carry on in case the booster shot are required, say, at the end of this year or even next year. And that also calls for the information system to track who needs to come back for the boosters. And then the last step, just because we done the vaccination, say we achieved the 70% population goal, that's the ADB set the goal, and WHO also set that goal. We need the evaluation, particularly we want to know among population who have received full vaccination, what's the protection effect in the real world, because that might vary slightly or significantly from the clinical trial. So that requires adequate information system that many economies still lacking. And we also one more information we also need to continue to evaluation is among people who are vaccinated, to what extent they are no longer contagious if they're infected. So that's another important piece of information that required. So from this chart, you can understand there's a high demand of the resources, including finance and including the information system, including tracking system, and also infrastructures. Next slide, please. So this is the latest the world on the economies, on the per capita spending in healthcare. The reason I show this is to illustrate even within the APEC, there's a huge variation and inequality on resources available. The US is a kind of an outlier, and there are more wealthy economy versus less wealthy economy. And that will affect how each economy mobilize their own both domestic and international resources. Next one, please. So in terms of financing source, generally speaking, there are domestic source and external source. Within a domestic source, there are regular, the Ministry of Health fiscal budgetary, but many economy during the pandemic also resort to emergency budgetary, but also beyond the Ministry of Health, to the Ministry of Finance and Ministry of Economics for emergency financing. Also, many economy also resort to extra budgetary mechanism because this is a once in a century emergency. In addition, the trust fund and bonds could be a source for domestic financing and resources. But I also especially want to emphasize in-kind resources, because when we talk about financing, mobilizing resources, where money is the most important resources, it's not the only resources. A lot of in-kind resources are required. For example, even in the resource-rich United States, that during the mass vaccination, it mobilized a lot of volunteers. The volunteers are required to organizing the vaccination site, to organizing the tracking, to organizing the information, communication, etc. So that in-kind resources will be varied, but an important source we should not forget. And then externally, I will not elaborate too much. The Asian Development Bank has a mechanism of financing. World Bank also has that together with the IMF. And then we have the WHO's COVAX. In addition, there could be a bilateral or multilateral agreements. And it is also possible to apply international grants and loans or bonds. Next one, please. So looking to the future, this is an opportunity for every economy to strengthen health system and infrastructure beyond the pandemic. All the infrastructure required, including information system for mass vaccination, will be applicable to other public health projects and vaccination for other diseases for the future. And it's important to recognize contextualization of resource mobilization and finance, because each economy has its unique situation and availability of resources, as well as in-kind resources. And the third point I'd like to make is vaccination is important to improve rather than to exacerbate social and health inequity we already observed throughout last year to the present. And the last point I'd like to make is it is important for the APEC economy to collaboration with each other, but also beyond APEC. A case in mind is India, who is not a member of APEC, but who now is suffering the worst consequences of the pandemic. And what happened in India has a global ripple effect. Among others, India is the #1 exporter of vaccines. And that includes the AstraZeneca vaccine that manufactured in India. And because of what happened in India, India temporarily withheld export. And that impacted Europe, Africa, Asia, Americas access to vaccines. And so that's an important example why it is important for international collaboration. And I will stop here. Thank you.
Great. Thank you so much, Dr. Chi. And I think some very, very salient points with regards to the importance of infrastructure, information systems, and how that is really important, not only for COVID-19 vaccination, but really an opportunity to strengthen for the future and to promote equitable access. So thank you for raising those points. And I think we'll definitely come back with some follow-up questions. I want to move now, though, to Marcelina, who I think, Dr. Islam, who's going to build on, I think, some of the points that you raised and really get more into how do countries mobilize the resources necessary to deliver COVID-19 vaccination and beyond. How should they think about that and, build on what Dr. Chi has outlined in terms of really mobilizing resources for some of those needs? Dr. Islam?
Great. Thank you, Anupama. And welcome everyone to the webinar. And I'm really pleased to be joining this. If you have the title slide up, I really will focus around this issue of how do we ensure adequate financing for routine immunization in the context of COVID-19. And really, Dr. Chi's really pulled out some important evidence of how COVID-19 vaccination has been proceeding and what some of the challenges have been. I will focus on one aspect primarily, next slide please, which is really in terms of securing resources for both routine immunization as well as COVID-19. Countries do require robust economic evidence, sort of contextually relevant, actionable economic evidence. And what I'll do a bit is really draw on some relevant case studies, country examples, and work that we've done, particularly in three areas. The first around how much does it cost to deliver routine immunization in the context of COVID-19. Second, what is the cost of delivering the vaccines in terms of being able to mobilize resources, we need to understand how much. And as Dr. Chi pointed out, it's just not only about the vaccine procurement itself, it's around the vaccination programs, it's around the health system, human resources, information systems, and others. So that type of evidence is going to be important. And then the third area is really then how much financing is available or needed for routine immunization, particularly as we move forward, as the health systems are challenged and stressed in the context of COVID-19. So next slide, this is sort of the first case study example around the issue of how much does it cost to deliver routine immunization. So one of the pieces of work that we had done at ThinkWell is really look at some evidence around this issue that, delivering routine immunization has changed now, and it's probably going to remain changed for the near to medium term into the future. And just very basic issues like, if you're going to deliver routine immunization, whether it be through your regular sites or altered sites, and in many countries, routine immunization were through school-based programs, particularly in lower and middle-income countries, or if you're going into the doctor's offices. Well, now those service delivery systems have to rework in terms of distancing, in terms of masks and gloves and other infection control measures, and those all have costs that need to be factored in terms of looking at future budgets, but also thinking about mobilizing those resources. And so a study across 8 countries really looked at some of the historical information around immunization expenditures and what the incremental costs would be. And of course, as you would expect, we find very large potential differences across these countries, from 20% to over 100% in terms of additional costs of delivering routine immunization. And this really is going to be important for countries to understand as national governments and development partners better anticipate and advocate for additional budget needs as Dr. Chi mentioned, World Bank, Asian Development Bank, and other partners are all supporting countries in terms of financing primarily COVID-19 vaccination efforts now, and Gavi and other organizations, particularly for lower and middle income countries, is going to continue to fund routine immunization programs. So these additional costs are going to be important in terms of having that evidence that will be needed at the country level. Next slide, please. Case study 2 is more focused on the cost of delivering the COVID vaccine. Again, as Dr. Chi pointed out, countries have made strong efforts at procuring the vaccines or at least reserving vaccines for future procurement, but that does not translate into delivering the vaccine, especially down to the subnational levels beyond the large urban metro centers in many of these countries. So this one piece of work that was done, again, through the COVAX working group is around the 92 Advanced Market Commitment, AMC countries and COVAX, and they really looked at, and we were part of this effort to really look at the incremental delivery costs for COVID vaccines across these countries. And really the costs are upwards of $2 on average, 2.82 per fully vaccinated person, and that's important. Again, as the funders look at resources for the COVID vaccine delivery, it's going to be important to continue to estimate this for the local context and make sure that we have the right evidence, especially to get to rural areas and hard-to-reach areas in many of these countries. Next slide, please. Case study 3 is around how much financing is available for routine immunization. Here I'll pick a relevant country example. In Indonesia, for example, we know that the Ministry of Health acted very rapidly at the onset of the pandemic to reallocate funding from routine service delivery towards COVID response, as was urgently needed, of course, in that country. And for the COVID response, there was reallocations of local level budgets for routine immunization. There was a lot of effort working with government and local level managers to really manage some of this budgeting process and support casuistic analysis of what the financing adjustments would look like for all essential services, including routine immunization, which is an important piece. And this evidence is now being used and really trying to understand what is happening at the local level and what local level managers are able to do or what their bottlenecks are to be able to access some of this funding. And I will mention, not just for the Indonesian context, but we've seen this across multiple countries, that just because there are national level resources allocated doesn't mean that at the local level, local governments, local facility managers are able to access and use those funding in a timely way, particularly as we know delays in routine immunization, particularly for under 5, will have an impact into the future. So facilitating access to funding down to subnational levels is absolutely going to be critical going forward. Next slide, please. So then just overall as a summary, we really are looking at using more evidence, more robust, actionable economic evidence that countries can use, country governments can use, as well as financing agents can use to really allocate these resources across countries and within countries from national to subnational level based on local needs. And this evidence will, of course, vary. There are different types of approaches, like doing investment cases for routine vaccination programs and adding new vaccines. So we heard about the booster vaccine that may be needed, looking at planning ahead in terms of the needs for that, as well as making it very contextual with local focus. And then, of course, advocating and engaging with government counterparts and other partners, including academia and others, to really advocate for use of the economic evidence for the resource mobilization. Next slide, please. So then in summary, overall, we do hope that this webinar will generate interest in more of this economic evidence and be thinking about how we use that evidence to advocate for the financing and broader dissemination across government counterparts. So I'll be happy to hear some questions around those. Thank you, and over to you, Anupama.
Great, thank you so much. And I really appreciate the case study examples of not only how this information and data is collected, but how it actually turns into action, as you've underscored the importance of it being actionable evidence that can be used to make decisions and support delivery of vaccination, whether COVID or routine. So thank you for that. And I'm sure we'll come back to you with a couple of questions. I want to shift now to Dr. Lee to continue to build on the discussion that we have had to date. When Dr. Chi first talking about what the needs are and where the resources may come from, Dr. Islam noting how we actually create the evidence to support the securing of the funding. And Dr. Lee, I want to ask you about sort of as we look beyond, how do we really look at long term, how do we expand vaccination funding and secure that more sustainable funding for immunizations across the life course as we start to see the greater need for incorporating broader age segments, new vaccines, and new ways of delivering? How do we think about this? What are some financing and budgeting strategies that can be used in the long term to secure this financing? So over to you, Dr. Lee.
Thank you. Next slide, please. As we know, immunization is the most cost-effective way to ensure our health. Many infectious diseases have been eliminated or even being eradicated. Our Constitution says the government should adopt and execute policies to improve welfare of women and children, and the government should promote preventive medicine. Next. However, because of the rapidly rising cost of new vaccines, our stakeholders pay only about half of the vaccine cost in recent years. Another half of the funding comes from tobacco tax. It appears very strange that smokers in Taiwan are now the strongest supporters for our vaccination program. Next. The problem is that there are many health interventions in competition for funding. Immunization may seem to be only a small part among these interventions, and immunization usually cannot draw much attention from the government. COVID-19 vaccine is an exception because the COVID-19 is too severe, and funding support may not be a problem, but this is not true for other vaccines, especially for the expensive ones. Next. A traditional way to persuade the stakeholder to give more support to immunization is to do a cost-effective analysis. A cost-effective vaccine may be more persuasive to stakeholders, especially when the government is rich enough to afford it. Next. However, I have to mention that most cost-effective analyses have ignored several important impacts other than physical health and life. For example, although human papillomavirus vaccine is used to prevent cervical cancer, prevention of genital warts is also important. Both cervical cancer and genital warts is associated with a huge psychological impact to the patient and to their families. Such psychological impacts had not been included in any traditional cost-effective analysis. Another example may be herpes zoster vaccine. It is not cost-effective if you count on money, but however, we know that herpes zoster is associated with much pain, and it will bring about a great psychological impact. Next. And to ensure a sustainable financing, we should have an independent budget for immunization. To do that, we have set up an immunization fund since 2010 here, and we made plans to incorporate more and more new vaccines into our NIT program each year, including pneumococcal vaccine for some adult populations. Next. However, as I have mentioned before, only half of our vaccine funds come from the government. The rest is supported by smokers. It can be expected that the government funding will not increase in the future. The tobacco tax also will not increase in the future. We will have no extra funding resources to support our new vaccination program in the future. Next. Donations from the industry or rich people are potential funding resources. We know that international vaccine donations are promoted and are handled by Gavi, next, and by UNICEF. However, these vaccine donations always go to low-income countries. Next. In many Asian countries, that has been influenced by Confucianism, the Confucius thoughts. We respect the elderly and we do not respect children. The juniors should always bow to the seniors, although the senior one may not be a good guy. Therefore, most donations here go to facilities and taking care of the elderly. Next. And many donations go to religious facilities, nothing for vaccines. Next. Now comes the most important question: how to mobilize diverse and sustainable financing for vaccines. I think the three most important things are awareness, and awareness. Increased awareness of the importance of vaccine and vaccine preventable disease will decrease vaccine hesitancy, increase vaccine acceptance, increase vaccine donation, and increase the motivation of stakeholders to support vaccination program. When everyone urges for immunization, the government cannot refuse the call. I think immunization-related educational program should be incorporated into public education, starting from primary school. We also must educate the media, medical students, and medical personnel. Next. Another way to solve the financial difficulty associated with immunization is the co-payment system. We have done a survey on parents' attitude toward co-payment for immunization in 2014. And the results show that most parents are willing to pay for some part of the vaccination fees if it is not so expensive. Next. As has been mentioned by previous speakers, cooperation among different economies is very important. This is especially true in Asia Pacific region. This slide shows that although many high-income and low-income countries have rotavirus vaccine in their routine vaccination program, most countries in Asia Pacific region do not have rotavirus vaccine in routine vaccination program because the government ignore the need, and the WHO, the Gavi, and the UNICEF do not pay much attention to middle-income countries. Next. This is also true for pneumococcal conjugate vaccine. Most middle-income countries in Asia Pacific region do not have pneumococcal conjugate vaccine in their routine vaccination program. Next. And this is also true for human papillomavirus vaccine. Most middle-income countries in Asia Pacific region do not have this vaccine in their routine vaccination program. Next. Some mechanism or platform for cooperation among different areas here are needed to communicate with each other to discuss our common problem and to ensure a sustainable financing for immunization. Next. Thank you.
Thank you so much, Dr. Lee. I think that's also great, building on the conversation and really adding to what I think is an important piece when we talk about funding, which is what is the value of vaccination to society? And so really appreciate your comments there. What I'd like to do now is actually open it back up to our panelists to see if they would like to respond to any of their each respective remarks. And I can start by posing a question. While I do that, I'd also really like to encourage the audience to start submitting your questions, because we will also shift to audience questions, but I'm going to get the discussion started. I want to build on the last point that Dr. Lee made, and maybe Dr. Islam, I would maybe pose this question to you, but welcome any of the panelists to comment on this. But I think what it got me thinking about is, how do we help our decision makers think about immunizations, not necessarily as just an expenditure, a budget line, a cost, but an investment? How have you seen that play out? What helps in taking that kind of necessary costing and evidence that's needed to help inform how much investment is needed, but really helping policymakers think about that as an investment in their communities and in their societies?
Absolutely. Thanks so much, Anupama. So there are different types of analyses, as we know, that are used in terms of this type of evidence. For example, investment cases, right? And what is the return on investment? And overall, I'll mention that there was a recently published study by Johns Hopkins University, and that looked at multiple low and middle income countries, over 90 low and middle income countries actually, and really looked at a cost of illness approach. And they found that the return on investment for each dollar invested in immunization in the routine program returned almost $20 in terms of sort of cost of illness averted, right? And there are other types of approaches looking at overall benefits, economic productivity, other types of measures to really help countries and funders to think about the benefits of routine immunization. These are sort of the economic benefits. There are, of course, clinical and health benefits that come from a different field of work that's equally important. So all of this evidence together, I think, is really going to be key in making it very accessible to the decision makers, looking at accessible and understanding it from the payer's perspective, so that they have the insights to really think about the full scope of what it means not to invest in immunization, and what it means to actually be very proactive in expanding the routine immunization program and proactively invest more. Hope that helps in sort of thinking through some of these. Thank you. Over back to you, Anupama.
Yeah, absolutely. Thank you. Would either of the other two panelists like to also comment on the question or on Dr. Islam's comments? If not, then I will move to another question, because I think you covered it nicely, especially about talking about the accessibility of that information, and really looking at it from the perspective of people who are making those decisions, whether payers and having to make that investment. So I think that's really important. I think just another question, also building on the last comments as well, or the last presentation from Dr. Lee, and maybe Dr. Chi.
Looks like Anupana was briefly cut off, but I think was looking for your responses or reactions, Dr. Chi.
Okay. Sorry for that interruption. What Anupama asked me to address is how will country address budgetary pressure resulting from this pandemic and identify new financing options. And in addressing that question, I'd like to just summarize that in terms of this pandemic and our control measure, there are roughly 3 phases. We are now in the second phase. The first phase was pre-vaccine. And everyone remember last year pre-vaccine, we have to institute very stringent safety hygiene measure, and some economy even have the lockdown. And that are very costly to control, to contain this pandemic. Now we are in phase 2, that vaccine is available. So in phase 2, compared with all the stringent measure we implemented last year, the vaccine is a much cheaper and relative cost-effective measure to contain it. And so every economy needs to recognize that. And of course, there's still the procurement and delivery issue of accessing vaccine. That's apart from that, every economy need to recognize that without effectively containing this pandemic, both lives and livelihood, our economy suffers. And so one mentality we can do is to address this as we're in a war. We are fighting the invisible enemy, that is the virus. And any country in that war mentality or war context will definitely mobilize most of its resources, prioritize in containing the enemy, in this case, the viruses. And in my presentation, I already mentioned about the sources of domestic and external funding sources. I will not elaborate that, but instead, I'd like to emphasize an important concept in public finance. The basic concept in public finance is to treat financing and expenditure as the two sides of the same coin. So on the financing side, we can mobilize both monetary resources as well as non-monetary resources. I already mentioned about community health workers and volunteers, and each economy may have different resources. It's just waiting for you to discover. And in the principle of community health worker, many economy has done task shifting by using teachers, nurses, etc., to mobilize them to contribute to the vaccination effort. And on the expenditure side, so when we are short in finance, besides find the funding sources, the other important direction is how to cut expenditure. And there are at least 2 important principles we can consider. One is how do we cut the costs of procurement and delivery of vaccination. And one example in mind is the WTO's TRIP agreement, that it allows economies to request a compulsory licensing, and that in effect can dramatically reduce the cost of the production and distribution of the vaccine. And India and South Africa applied to WTO last October has been stalled. And fortunately, on May 4th, the President Biden of the United States agreed to support the waiver of intellectual property right. And that paved the way, hopefully in the future, to reduce the cost of producing the vaccines. And in addition, cutting costs, each economy can think this way. How can we most efficiently distribute and vaccinate the necessary population? And there's no one size fits all. In each economy, you have different contexts, different resources, different infrastructure. And you just need to be innovative to discover what are the available resources out there that can help the economy to efficiently vaccinate as many people as possible with as little cost as possible.
Thank you so much, Dr. Chi, and I apologize. I think I had a little bit of a technical glitch, but I appreciate you delving into this question around how countries can address budgetary constraints. Would either of the 2 panelists like to comment on that particular question, or I can post another question? Okay, so maybe just building on that, I was wondering if any of you would like to just touch on the question of stakeholders and how can advocates and stakeholders and partners working in the immunization space work better to address issues of financing? And how can our stakeholders and experts in the field of financing work better to strengthen immunization financing? Would welcome any thoughts or reflections or even country examples where that has worked well.
Is this question for Dr. Lee?
It's open to anyone. Would you like to take it, Dr. Chi?
Okay. In terms of the policymaker for the APEC economies, this is actually I was going to address at the last question you're going to pose, so I'm just moving it forward. And one idea I have is for APEC members to work together, because we are now facing, except for maybe with the exception of United States, the vast majority of the economy in APEC are facing the shortage of vaccine, both in procurement but also in delivery. And it might be helpful for APEC member to get together and to form some kind of collaborative purchasing agent, meaning as a big block to expand our negotiating power in both compulsory licensing and hopefully to expand the local production. By compulsory licensing, that can address the big barrier of delivery. As I mentioned in my talk, that procurement does not equal delivery. And since the vast majority of production are in the US and in Europe, and also India, but India are in trouble, so it temporarily withheld export. And so if we can expand the local production, particularly in the Asia Pacific region, and that will help address these extreme shortage issues.
Thank you for that, Dr. Chi. And I think you've raised another interesting point as well for discussion around something that we haven't touched on in this discussion, which is investment in the upstream side of vaccine development and manufacturing. I think a lot of our discussion today has focused on the downstream, the delivery of vaccines and vaccination programs, but you raise an interesting point around how our APEC economies and other economies around the world really looking at what is their investment in the life sciences sector, in promoting development, discovery, research, and manufacturing. So I think another interesting element that you raise as well in this discussion around financing. With that, I think you also brought up another really great point, which is what is it that APEC economies can do together or can do more of when it comes to collaboration? And I would welcome perhaps some additional thoughts on this question from Dr. Lee.
Okay, thank you. And firstly, I want to echo the the opinion of Dr. Professor Chi. And I think locally manufactured vaccine may be important for this area because it can lower down the cost and facilitate the delivery of the vaccine, especially when we have a COVID pandemic. And we realize that we cannot rely totally on imported COVID-19 vaccine. So at the beginning of the pandemic, we have three vaccine manufacturers try to develop a new COVID-19 vaccine. And before June, we anticipate that one or two locally made COVID-19 vaccine may be available. And here, and in the future, we will make enterovirus 71 vaccine and the dengue fever vaccine. So locally manufactured and vaccine may be important to, and when we have a new vaccine, when we have a locally made vaccine, I think it to have a platform for communication and for common strategy is may facilitate the distribution of and the availability of vaccines in Asia Pacific region, because I have mentioned before, many many of us are middle income countries, and our government usually do not pay much attention to immunization. I think one of the reasons is that if you give some vaccines to the people, the effect of vaccination may occur several years after the vaccination program. And at that time, they are not the president, they are not in the in the government now. So the government usually prefer to build some fancy roads, fancy building, but not for vaccination program. So I think the awareness, I always I always emphasize that awareness of the public is very important. When you have everyone have the awareness of the importance of vaccines, the government will invest more on vaccination program, on the development of the vaccine, and such issues can be addressed and discussed in some cooperative mechanism in this area. Thank you.
Great, thank you for that. And I think that underscoring again, coming back to sort of how do we value vaccination? How is there the demand not only for vaccination services, but for continued investment to happen, whether those are immediate benefits that we see from vaccination or those are over the long term. Was there someone else that was going to comment? I think I just cut someone off. Okay. I think there was one question, at least, that I saw from the audience. So I do want to go to that question, as well as if there's others. And maybe, Mitchell, you could pull up a few more. I think I lost some of the questions when I lost my connection for a minute. But one of the questions, I think, comes back to something that the panelists have already discussed, which is around that short-term focus and the incredible, much needed response today around COVID-19 and the investments that are being made today in the infrastructure to deliver COVID-19 vaccines or for COVID response in general. How can we, again, better encourage policymakers to not just look at the short term, but to sustain that kind of attention and investment in the long term, so that we can continue to have the infrastructure and systems necessary for equitable access within country or within countries and within, in particular within our APEC economies. I think, Dr. Lee, you touched on this already a little bit when it comes to, again, how do we look at the value of vaccination and really use this moment to underscore that for sustained investment. I'm wondering, Dr. Islam, would you like to take that question around investment and how do we go from short-term to long-term sustainable investment?
Yeah, sure. And that really is a great question. A lot of the focus, as we know right now, is on the COVID vaccine, of course. And as we heard, there's likely to be a booster vaccine that's going to be needed. Who knows, COVID vaccine may need to become part of the routine immunization programs going forward. And there are going to be other adult vaccines that are going to come on board that are already on board, and there are going to be others that countries are going to start to add to their life course, sort of thinking of life course vaccinations. So having a longer term investment focus is going to be key. And the issues around awareness, as others have mentioned, as well as the evidence, and really sort of going back to my earlier point about generating this evidence and having that be easily accessible to the policymakers is going to be key. I think it is it is, of course, right now it's very difficult because the focus is on short term, but I think we are going to look back and look at analyses that are more, 5 to 10 year time frame and really estimating out what these mean for the programs and really looking at the health systems and the human resource needs in the systems and finding ways to deliver these vaccines that may not be through the traditional routine vaccine channels that are traditionally done for childhood vaccines and under 5 vaccines. So thinking of alternative delivery options that are not just in this current emergency mode is going to be key. Thank you, Over.
Great, thank you for that. And it got me thinking as well a little bit about, and maybe Dr. Lee, I'll come to you with this question. You noted many of the economies in the APEC region are middle income countries, but really do span quite a range. And the funding that the Asian Development Bank, the new system, the mechanism, APVAX, that has been established in the region, my understanding is that there's a variety of different both grants and loan mechanisms that are now economies are accessing to support not just procurement of COVID-19 vaccines, but to strengthen delivery. And I think the ADB has noted that one of the things they really want to ensure is that the vaccines are getting to people. Curious to know how you see some of those such types of mechanisms that have been stood up in the short term, like APVAX. What impact might they have? How might economies think about such mechanisms from development banks in the long term, and what role those might play?
I'm not quite familiar with the mechanism you are talking about, and I think the question now is that COVID-19 has gone into, most COVID-19 vaccines go into high-income countries, and only a few of them go to middle-income and low-income countries. This is a great problem in equity of vaccine for COVID-19 vaccines, and I think I think this is cannot be avoided because everyone want to protect themselves. So this is why we decided to make our own COVID-19 vaccine. Early in last May, we have a decision to make as soon as possible a COVID-19 vaccine here. I think there are many COVID-19 vaccine may launch to the market in the future. The major problem for the future COVID-19 vaccine is that they cannot do a phase 3 efficacy study because it is too expensive and the pandemic will go in the future, and it is difficult to enroll enough subjects to test the vaccine efficacy, and it may not be ethical to test the vaccine efficacy in the future because you have available effective COVID-19 vaccines. So I think the question now is that WHO should fasten their step in establishing a so-called immune correlate of protection. You must set up a standard of the antibody level to become a guidance for the future vaccine development. If we have many COVID-19 vaccine in the world, I think it may solve the problem that many countries cannot get enough COVID-19 vaccine, especially in Asia Pacific region. Thank you.
Thank you for that. I think I'd like to. Oh, sorry, Dr. Chi, did you want to comment?
Yes. I just have one more comment about the ADB's policy in their APVAX. In March, ADB just approved 400 million to Philippines, 450 million to Indonesia. But those are loans specifically for vaccine procurement. And related to your question, I think the APEC put a pressure or influence for ADB to expand the usage of those loans because, as I mentioned, those 400 million and 450 million to Philippines and Indonesia were exclusively for procurement. ideally, they should expand beyond procurement, as we already discussed. Just by procuring vaccine is totally inadequate. That there's a lot of resource required and financing required for the infrastructure building, for the information system. And if we can ask ADB to expand the usage of those loans, that potentially will pave a long-term impact, because as we discussed earlier, those strengthening those infrastructure is not just for one-time use for the COVID-19 vaccination. So once those infrastructure are built, are strengthened, in the future, general public health and other communicable disease, they will be an extremely important infrastructure.
No, thank you for that, Dr. Chi. I think that's a really great point. And if I could actually ask you maybe to just elaborate on that, which is, I think, with the infrastructure, especially when we look at COVID-19, the initial vaccination rollout has been focused around adults, the elderly, different age cohorts than what often, immunization programs are focused on pediatric or adolescent. What does this teach us about reaching adult populations, about reaching different populations than what we see in some of the immunization programs currently? What does it mean for the kinds of infrastructure and health system needs that we might need moving forward, not just for COVID-19, but for other adult immunizations?
Yes, that's a very good question. Each economy have its a very unique context. And I believe and understand each economy face the similar issue that even a rich economy like United States face. And based on the experience of the US rollout of vaccination, we have seen huge diversity in terms of progress. Even though the vaccine were generally equally distributed to each state and county, yet we observe in each state and county and also across population, the vaccination rate varies dramatically. And one particular point I mentioned in my presentation is availability does not equal accessibility. And in the US, we already seen, for example, the minority population, people of color, their vaccination rate are extremely low compared with the general particular white population. Why? Because a large portion of those minority population are working in the frontline work, such as migrant farming workers, meat and food processing. And they don't have easy access to vaccination site. So I have been strongly urged in the United States that the county health department who administer those vaccination, instead of passively waiting for people to come to vaccinate, they need to be actively bring the vaccine and the delivery vaccination to the site, to the people. And that is an example that it happened in a very rich economy like United States. And I can imagine the similar situation will exist across all countries. And you need to identify which population, which community will have difficulty to access, even if the vaccine is available. And that also requires additional resources, mainly human resources, to bring the vaccine to the target or the vulnerable population instead of waiting passively for them to come.
Yeah, no, thank you for that. I think it's a really good point around thinking about how our investments in infrastructure really do reach that end individual, that last mile for underserved communities and populations, and are accessible as possible. I think in the last remaining couple minutes that we have, what I'd love to do is take a question that I actually have here in the chat from the audience around if each of the panelists could share just one policy recommendation, if there's one thing that you hope comes out of this pandemic, what is it that you hope decision makers, policymakers keep in mind as they're thinking about investing in immunizations in the long term? So perhaps I will go first. Dr. Lee, would you like to share one policy recommendation? And then I'll go to Dr. Islam and then to Dr. Chi.
I think the the biggest question here is the funding resources for vaccination, and COVID-19 pandemic may be one alarm to our politicians. They may become a textbook teaching our politicians that controlling the pandemic by quarantine procedures or treating the patient with some antiviral agent, they are not very effective. The most effective way to get rid of the threat from the pandemic is to give effective vaccine. And locally manufactured vaccine is very important. So I think politicians may be more willing to give investment on the vaccination program in the future because they must have learned something from this pandemic, and because we put much investment in our COVID-19 vaccine development here. So I anticipate that with this with this experience, we may be able to make more and more vaccines here, and the vaccine cost and maybe lower down in the future, and vaccine delivery and vaccine confidence may be increased in the future. And that's, I hope in the future something good will be happening for our vaccination program. Thank you.
Great, thank you. Dr. Islam, policy recommendation or something you hope that our policymakers take away from this pandemic?
Absolutely, yeah. Thanks for that, Anupama. And really sort of building off of my earlier remarks and some of the points that were raised here, to think about subnational level financing. So while policymakers are ensuring that national level funding is available and resources are being brought to bear on both COVID vaccination and immunization, routine immunization more broadly, to then take it down to the subnational level and really ensure that at the local level, financing is available, it is equitable and accessible to the local governments, the local facility managers, to really ensure that vaccination is reached, particularly that last mile that we always talk about, in this case for adults, but for routine immunization for all age cohorts. So that would be an important piece to really focus on. Thank you. Over to you.
Great. Thank you, Dr. Islam. And lastly, Dr. Chi.
This pandemic has taught us many things, and among those things, one important thing related to public health is it certainly remind us that something we in regular time before the pandemic we don't pay much attention to is the importance of the public health infrastructure. Even the wealthy economy like United States are being reminded, a rude awakening, that many counties, many states has a very relatively poor development of public health infrastructure. So this is a great opportunity for every economist government to take this opportunity to strengthen their public health and infrastructure. And in that process, it's important to pay one specific attention that people who suffer from deaths and disease of this pandemic were invariably high proportion of people of the low income or the disadvantaged population. So in the process of strengthening public health infrastructure, it's important to pay attention to equitable distribution of resources and infrastructure. And also earlier I mentioned that in the fight for this pandemic, to control this pandemic, there are two phases. The first phase was last year, primarily last year, pre-vaccine phase, try to control it. And now we are into the second phase of containment. That's after we have the vaccine. And as Dr. Lee also mentioned, vaccine is the most cost-effective way to contain this pandemic. But I don't think this pandemic will be over within a short period of time. That even if we achieve the herd immunity, the virus will still be with us for a little bit longer. That means we will move into the third phase, the maintenance of the containment. And that is also important to maintain a very strong public health infrastructure. So what we urge every government to build upon a strong public health infrastructure is not just for the control of this pandemic, but into the next phase, the maintenance of the pandemic, but also into the future of a stronger population health. Thank you.
Thank you. That was very well said. And I want to thank you, Dr. Chi, Dr. Islam, Dr. Lee, for your time and your insights and expertise today. And I want to thank all of our audience for being here with us today, as well as thank you to the APEC Life Sciences Forum. Thank you very much. And with that, I'll hand it back to Mitchell for any final comments.
Thank you very much.
Thank you so much, Anupama, to all of our speakers, and of course to the audience. I know we're a little bit past time, so I won't hold you much longer, but as mentioned at the beginning of this session, we will be sharing the recording of this session as well as summary of this session, and you'll be able to review previous webinars that we've held on our event site. So definitely keep a lookout in your email for updates on that. Or if you're joining us from the live stream, feel free to peruse other sessions from that platform as well. The last thing I'll mention is just that we'll plan to be sending out from the LSIF Secretariat a very quick survey just to gauge the impact of the material that we've addressed in this and the previous sessions, and also collecting some of your thoughts on some issue areas you might like to see addressed in our upcoming webinars, particularly related to regulatory and supply chain issues, which are, of course, of critical importance currently. So with that, thank you again to everyone who's been a part of this. Enjoy the rest of your day or have a good night, and we'll hopefully see you soon. Thank you so much.
Thank you.
Thank you.